Good morning, class. Today we have a very special guest joining us by teleconference to discuss carotid artery disease, which I think you'll agree is a very sticky subject. Well, joining us on the line is your friend and mine, Dr. Saunders. Dr. Saunders, are you with us?
Well, indeed I am, and pleased as punch to wade into this subject with you. I declare by the time I'm done, you're going to want to give me a plaque.
Dr. Saunders, there appears to be some confusion in the field regarding the proper way to document and code carotid artery disease. Is it correct to code I77.9, disorder of arteries and arterioles unspecified, which triggers HCC category 108, or I65.29, occlusion and stenosis of unspecified carotid artery, which triggers RxHCC 206?
Well, this is a slippery one. Now, we are always preaching that providers should document to the highest specificity or knowledge of the particular diagnosis as they can, and that remains the cardinal rule. But something interesting happens with carotid artery disease, and it is highly unusual. In this case, the unspecified code triggers a higher payment, but the correct way to document and code is to utilize all of the information that we have to come up with the proper and compliant diagnosis. We need to consider the definition of the disease and the information in the progress note when assigning the proper code. The clinical definition of carotid artery disease reads, carotid artery disease occurs when the carotid arteries become narrowed or blocked.
Correct me if I'm wrong, Dr. Saunders, but that is occlusion, is it not?
I'll be Jim Dandy, it is. Furthermore, plaque is arteriosclerosis. You want to show them the chart?
Indeed.
You see, that is not I77.9, disorder of arteries and arterioles unspecified, which does not specify whether it is carotid, coronary, or other arteries, or that it is from atherosclerosis.
Indeed not. So a progress note that states, carotid artery disease, Doppler study reveals 40% blockage, should be coded with one of the codes under I65. If the documentation specifically states stenosis and carotid, then you would code I65.29. Atherosclerosis of carotid is also from the I65.2X series of codes, as is arteriosclerosis of the carotids.
Oh, that is absolutely right. Now, if your wife sends you to the market to get cherry tomatoes, and you get regular tomatoes, you're technically correct, but you're still in trouble.
So when is it appropriate to code I77.9?
Now, according to the AHA, carotid artery disease is a vague term that lacks specificity. When there is no further information regarding the nature of the condition, assign code I77.9, disorder of arteries and arterioles unspecified. But this should only be used in a case where the notes do not mention specifics. And as you know, specifics are key to coding correctly under ICD-10.
Bring home the cherry tomatoes or else.
Yes, cherry tomatoes.
Yes, tomatoes. That's all for now. Class dismissed. These links will take you to the ICD-10 CM guidelines, the 2017 crosswalk of codes to HCC and RxHCC categories, and to the most current listing of ICD-10 CM codes on the CMS site. Please feel free to muck about in them for clarification and further edification.